I wasn't really the mom type. I think I thought more of myself as a career woman and wondered if I ever would have kids. So it was interesting to me that I ended up having children, having 3 children, and really enjoying being a mom. When people ask me who Isabella was, I feel like over time my answer has changed so much because since she was my first child, everything that she was just who I thought kids were. She was just absolutely amazing. You know, she kept complaining about back pain and stomach pain. You would never think that actually inside is a stage 4 tumor. So our world just got turned upside down. Well, your immediate reaction is, let me get out of here. Let me go process this on my own. But instead, you know, they just bring in person after person and people are like, have you thought of this? Everyone's asking you questions and you're just like, give us a minute. So initially our treatment journey started like everyone else's, where they immediately start you on chemo. You always think that whatever your doctor tells you is your treatment plan, but is this the right treatment plan? Which is not something I ever thought I would ask either, right? Me being comfortable wasn't an option. I didn't care that it was the hospital in our town. If I have to fly 4 hours to get her somewhere that's the best treatment, then that's what we're gonna do. The treatment that we received was never mentioned to us from our home hospital system. It was just something that we found and explored ourselves. I just didn't know what else to do, and it was the right thing. We were able to build memories and still go do amazing things, and she lived such a great life. I've always been a firm believer in being a care advocate. I think that there are so many more options out there for your children, and I encourage you to research those. Some of those that we've experienced are things like DANYELZA.
What is DANYELZA? DANYELZA is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy. It is not known if DANYELZA is safe and effective in children younger than 1 year of age. Important safety information. What is the most important information I should know about DANYELZA? DANYELZA may cause serious side effects, including serious infusion-related reactions. DANYELZA can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with DANYELZA. Tell your healthcare provider right away if you get any signs or symptoms during or after your DANYELZA infusion, including swelling of your face, eyes, lips, mouth, or tongue, itching, redness on your face, flushing, skin rash or hives, trouble breathing, cough or wheezing, noisy, high-pitched breathing, feeling faint or dizziness, low blood pressure, nervous system problems. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems, including severe pain from nerves, neuropathic pain, including pain in the belly, abdomen, bone, neck, legs, or arms. Pain is common with DANYELZA and can be severe. Inflammation of the spinal cord. Signs or symptoms may include weakness in your legs or arms, bladder and bowel problems, pain in back, legs, or stomach, abdomen, numbness, tingling, burning sensation, reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, PRES. PRES is a condition that affects the brain. Your healthcare provider will monitor your blood pressure and check for any neurologic symptoms after your DANYELZA infusion. Signs or symptoms of PRES may include severe headache, vision changes, changes in mental status such as confusion, disorientation, or decreased alertness, difficulty speaking, weakness in your arms or legs, seizures, numbness, tingling, or burning sensation in the arms or legs, nervous system problems of the eye. Signs or symptoms may include unequal pupil size, blurred vision, trouble focusing your eyes, larger pupil size, dilated, decreased ability to see, sensitivity to light, problems urinating or emptying your bladder, prolonged urinary retention. Do not receive DANYELZA if you have had a severe allergic reaction to naxitamab-gqgk, the active ingredient in DANYELZA. Ask your healthcare provider if you are not sure. Before receiving DANYELZA, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have heart disease, are pregnant or plan to become pregnant. DANYELZA may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start treatment with DANYELZA. Females who are able to become pregnant should use effective birth control, contraception, during treatment, and for 2 months after your last dose of DANYELZA. Talk to your healthcare provider about birth control choices that may be right for you during this time. Tell your healthcare provider right away if you become pregnant or think you might be pregnant during treatment with DANYELZA. Are breastfeeding or plan to breastfeed. It is not known if DANYELZA passes into your breast milk. Do not breastfeed during treatment and for 2 months after your last dose of DANYELZA. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of DANYELZA? DANYELZA may cause serious side effects, including C. What is the most important information I should know about DANYELZA? Swelling of the heart, myocarditis. Myocarditis has happened in adolescents ages 12 through 18 within days of receiving DANYELZA. Tell your healthcare provider if you get any signs or symptoms of myocarditis, including chest pain, shortness of breath, irregular heartbeat or feel like your heart is racing. High blood pressure, hypertension. High blood pressure is common in people who receive DANYELZA. Your blood pressure will be monitored during your DANYELZA infusion, and at least each day on days 1 to 8 of each DANYELZA treatment cycle. Tell your healthcare provider right away if you get any signs or symptoms of high blood pressure, including headaches, seizures, nausea or vomiting, chest pain, dizziness, visual changes, shortness of breath, feeling that your heart is pounding or racing, palpitations, nosebleeds, decreased blood pressure, orthostatic hypotension that can be severe and require hospitalization. You may feel dizzy, lightheaded, or pass out, faint when you rise too quickly from a sitting or lying position. Your healthcare provider will monitor your blood pressure before you start and during treatment with DANYELZA. The most common side effects of DANYELZA include fast heart rate, vomiting, cough, nausea, decreased white blood cell, red blood cell, and platelet counts, diarrhea, decreased appetite, tiredness, skin rashes, decreased level of potassium, sodium, and phosphate in the blood, hives, fever, headache, injection site reaction, swelling of the body or only in one part of the body, anxiety, irritability, increased liver function blood tests, decreased blood sugar level, decreased calcium levels in the blood, decreased protein levels, albumin in the blood. These are not all of the possible side effects of DANYELZA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.